Hello, my name is Dr. Dudley Manns. I'd like to tell you about our vision to build a brand new mental health hospital in Bedford and to redevelop our existing inpatient services in Luton, giving us two up-to-date, high-quality mental health hospitals serving the populations of Bedford Borough, Central Bedfordshire and Luton. We're committed to developing community and inpatient mental health services that deliver the best possible outcomes for our children and young people, adults of working age and older adults.
Some of our environments where we provide inpatient care could be better. Despite the best efforts of our fantastic staff, our current environments do not always promote recovery, privacy and dignity. This is our opportunity to focus on creating spaces that reflect the needs of our service users and staff.
We have inpatient services spread across 4 sites, 5 including London, which also include 2 isolated standalone units at Oakley Court and Townsend Court. By creating 2 centres of excellence, it would enable us to ensure that we can provide the right concentration of staffing and expertise to deliver the best possible care and support for patients. It would also allow us to offer more joined-up care through closer links with physical health and community mental health services.
People in Bedford and the north of Central Bedfordshire and their families currently have to travel long distances to current inpatient units at Townsend Court, Oakley Court, the Luton Centre for Mental Health and at times to London. These proposals will mean adults from Bedford who need to be admitted for hospital care could be admitted to a new hospital built on Bedford Health Village. Adults from Luton would be admitted to Luton. Adults from Central Bedfordshire would be admitted to the facility closest to home.
There are currently no inpatient units for our young people across Bedfordshire, Luton or Milton Keynes. A temporary facility is being planned, but our proposals will provide a long-term site for young people across Bedfordshire, Luton and Milton Keynes to be supported much closer to home.
I was 13 when I went into inpatient care in Essex, Rochford, and the impact it had on my family was dreadful, especially my mum. She was doing day and night shifts trying to get money to be able to come and see me, but then not having enough money for food, so having to go to food banks. And having a unit in Bedford would have been beneficial for not just me, but the whole family, because I would have been able to see my brothers more often, whereas when I was in Essex, I didn't see them at all. And also having friends that I go to school with, having them to come and see me would have just made me feel not as isolated. And I feel like if I was able to have them around me, I could have probably got out of hospital a lot quicker, because having the impact of my mum struggling and having no one around me made me stay in hospital longer.
When people are in their greatest need and require an inpatient mental health bed, we need to ensure that there is always a bed available locally.
The Trust is working with the partners to change how care is provided and prevent more people needing to be admitted in the first place. This involves community mental health services, working in a joined-up way across the voluntary sector, GPs, mental health services, and social care. It also includes inpatient centres of excellence that provide cutting-edge treatment and support rooted in the communities which they are based.
We think this is the right thing to do, but a vital part of this process is listening to service users, carers, partners and the public. This is your NHS and we want to hear your views.